Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining me today. I'm the Senior Vice President for the Bryant Wellness Institutes. We are Louisiana's most advanced functional medicine institutes, and I'm here with my co-host, Brandon Como. Brandon, how are you today?
Doing well, sir.
Man, I'm excited about starting a new initiative today, and I think that this is going to help so many people here in the Acadiana area. And, you know, I come here every week, not just to hope to give you an interesting show, but the purpose of this show is to try to help people with their diseases and actually get well. And the reason I call the show Get Well Acadiana is because that's my goal. You know, my purpose is to try to help as many people as possible lead a healthier life using non-drug, non-surgical solutions. And so we've been tremendously successful at that just in the few short weeks we've been doing the show. And we've already seen lives changed because of this show. So thank you all for listening. I'm so excited to be able to bring this information to you every week. And I've got a good one for you today. We're starting a new initiative at the Bryant Wellness Institutes today on diabetes and obesity. And I've coupled diabetes and obesity together in one program because both of these are simply side effects of the body not processing its insulin and leptin correctly. So they're basically the same thing. And you're going to learn all about that later on in the show. Now, before we get started, I have to tell you, all of you out there with diabetes and obesity, that this is a real problem in this area. And I would be willing to bet that everyone out there listening, everybody that can hear my voice, you either have diabetes, know someone that has diabetes or weight problems, or are developing pre-diabetes. So there are thousands of you out there listening that are developing pre-diabetes and don't even know it. You know, pre-diabetes has no symptoms to alert you that your health is headed in the wrong direction, but literally thousands of you out there are developing pre-diabetes, and being overweight or having trouble losing weight is a major sign that you may be one of those that has pre-diabetes. Now, 35% of the adult population in America has pre-diabetes. So that's 1/3. 1/3 of the entire population has pre-diabetes. But in Louisiana, it's much higher than that. It might be as much as 50%. So it's likely that half of Louisianians have pre-diabetes. Now, way over 50% of people in Louisiana over 65 have pre-diabetes. So if you're over 65 years old, there's a big chance that you either have diabetes or pre-diabetes or are developing those. Now, as far as weight problems go, 1/3 of Americans are overweight and another 1/3 are obese. So 2/3 of Americans have weight problems, and diabetes is the number one reason for leg amputations. You know, 60% of lower limb amputations are from diabetes. It's the number one cause of blindness. It's the number one cause of kidney failure. This is a huge problem, and especially when you learn today by listening to the rest of this show that we're not even addressing what we should be addressing whenever it comes to diabetes and weight problems. We're not even getting to the right things that we should be looking at. So the rates of diabetes are growing faster than ever before in the history of mankind. And, you know, America has the highest rate of diabetes and weight problems of any other country on earth. And Louisiana specifically is at the very top of the states with diabetes, and we have the highest rates of obesity and Louisiana has one of the earliest death rates. So I'm talking to all of you Acadiana residents out there. We've got to get this under control now more than ever before, you know, before more deaths occur. And I see every day the devastating effects that diabetes and obesity has on my patients. And so I'm so happy to finally be bringing you solutions that are real common sense things that work, that's drug-free, 100% surgery-free, 100% natural. Now, being overweight is simply a side effect of the way your body processes insulin and leptin. And diabetes also is a side effect of the way your body processes its insulin and its leptin. And so we're treating the side effects. We're not actually treating the underlying reasons that you have diabetes and weight problems to begin with. Now, here's the biggest problem that I see with patients that have diabetes. And please hear this. People think that as long as their blood sugar numbers are okay, then they're healthy. And we've actually been taught that as long as my diabetes medicine is keeping my blood sugar numbers in this box, everything is fine. And I promise you that's not accurate. As diabetes progresses, and as you're going to see today, as diabetes progresses, your cells get more and more resistant to their insulin. Worse and worse things start to cascade in your body until you end up with losing the legs, losing your eyesight, losing your kidney function, getting put on kidney dialysis. So you're going to see today that just managing your blood sugar is not the only answer. But I see this all the time. You know, I'll ask my patients or people that I'm consulting, and listen, I've consulted over 10,000 patients in the last 20 years, and when I'm consulting patients, I'll ask them, I'll say, well, rate your health on a scale of 1 to 10. Often people with diabetes that are obese, that are on metformin or some other medicines, they'll say, well, I'm about a 7 or an 8. I'll say, well, yes, but you have diabetes. Oh, yeah, that doesn't matter, though. It's no big deal. My metformin, it keeps my blood sugar numbers good. So last time I went to my doctor, everything was fine. That's a dangerous way of thinking. That doesn't work that way. And then I'll say, well, yes, but you're overweight. And they'll go, oh, yeah, but my family's just big boned. Guys, I hate to tell y'all this, but if we took your bones out and we put them next to a person that's normal weight, that's thin and healthy, they're going to be the same size. So you have weight problems. That we have to take this out and really look at it for what it is. These are problems that are going to cause your health to fail later on, and we have to begin to take a real hard look at the way we're managing this diabetes and this weight. So thinking, oh, I'm fine, my blood sugar is good, is a very dangerous way of thinking. So today is a big day for us. I've been working on this new initiative to be one of the largest programs that we've ever done at Bryant Wellness Institutes. And so what we've done is we've opened up 20 new spots for our diabetes and weight loss program. And actually, honestly, Brandon, what we did, our functional medicine program was almost full last month, and we were running out of space to get into our program. So instead of starting a waiting list, which means we would have to basically turn people away and allow them to get sicker simply because we didn't have any more openings available. So what we did was we opened up a new room in our clinic dedicated to the functional medicine work, and we actually ordered a whole new complete set of equipment. So we doubled our capacity to try to help more people without having to put people on a waiting list and letting them continue to get sicker. So basically we just doubled our capacity. So I'm taking 20 new people looking for drug-free solutions for their diabetes or looking to lose weight. And I'm actually going to be hosting a free community workshop to talk to you about how my program works, show you the technology, and to see if it's a good fit for you, and then to also see if you're a good fit for our program. We don't accept everyone. We only accept patients that we truly feel like we can help. So if their condition is something that's permanent that we can't solve or that we don't feel like that we can help them, we don't accept them. Sometimes I don't accept people because they're not committed enough for change. I always ask my potential patients, like on a scale of 1 to 10, rate your commitment to getting rid of your health problems. I only accept patients that say they're a 9 or a 10. And that's because I'm a 10. And if I want you to be more healthy than what you want to be healthy, that's frustrating. They say things like, oh, doc, I can't come tomorrow. I have a haircut. I have a haircut appointment or something, and I'm sorry, you're not ready for change yet. You're not sick of being sick enough yet. And so if you are truly ready to turn your health around, if you're sick of being sick, if you're tired of being overweight and heavy, if you feel like that you've tried everything to lose weight and nothing has worked, there are some underlying secrets. There are some underlying reasons inside your body that are happening that are preventing you from losing weight and being healthy. You know, I tell my weight loss patients and my diabetes patients this all the time. It doesn't have to be this hard. You know, losing weight should not be as hard as it is. But the key is you've got to address the underlying reasons inside your body that's preventing you from losing weight first. And then the weight loss part of it's just kind of a side effect. That's kind of the easy part. So we'll also talk a lot about increasing your energy. If you don't have the energy to stay active, that's going to really slow down our weight program and our diabetes program. So I have a whole section in there on energy. I'm going to show you how to increase your energy by 40% in as little as 14 days. And it's real simple to do, actually. Now, we start with the idea of why have your cells become resistant to their insulin, and how can we make them work better? And this is an angle that no one else is talking about. So the biggest challenge, the number one problem that I see with talking to people is that they think that their blood sugar and their medicine is keeping them, it's fixed them. And that's not the truth at all. So diabetes is not a blood sugar problem. It's an insulin problem. Diabetes means that your cells have become resistant to insulin. And the problem is that traditional lab work, they don't even check your insulin. So they don't check the main parameter that shows you what's going on with the diabetes in the first place. All they check is blood sugar. And diabetes is not a blood sugar problem. And if your blood sugar is normal, but your insulin levels are 5 times normal, then you're in real trouble, because insulin is toxic in very high levels in humans. So right after this break, when we get back, I'm going to teach you a little bit about what diabetes is, what insulin does, and what other hormones are involved, and what you should be looking for, and so that you can reach a higher level of health and possibly begin to solve some of these disease processes in your body. And if you know someone with diabetes or weight problems, call and text them and tell them to tune into the show right after this break and after this next segment, because I'm going to talk to you a lot about what diabetes actually is and what can be done about it. Now, if you want to register for my workshop, it's going to be June the 1st at 7 p.m. at the Hilton Garden Inn. It's called 4 Secrets to Beating Diabetes and Obesity. And I have only 20 spots available. And then after that, we are going to have to start a waiting list. So don't miss your chance to prevent these terrible complications of diabetes that you may be developing. And remember, even if you just have weight problems that you can't lose weight, you likely also have pre-diabetes with it, which is something that we will address. So call and register right now at 837-7174. That's 837-7174. And just leave your name and number on the machine. And obviously, it's Saturday morning. We're not in the office on Saturday. So just leave your name and number on the machine. And when we get back into the office Monday, we'll call you back and reserve your seat. And I want to encourage you to bring a guest with you that also has diabetes. It helps so much when going through a program like this. If you have a partner who is going through the same thing that you have, where, you know, you guys can kind of be buddies and have a partner in this process. And if you don't have that, then bring a spouse or a sister or another loved one. And if you don't have any of that, just come by yourself. That's fine too. Now, I have a whole program that I do for kids and teens with weight problems. Guys, this is an issue that's very dear to my heart, and we're going to talk more about this in the next segment. We see our kids as perfect, but if your child is heavy, you really need to take an honest look at that and turn this around now. You're going to help them with every aspect of their lives. We have a whole program for kids and teens with weight problems. We do it very gently. The kids really love it. I can show them how to eat healthy and still eat like a kid. It's a great program. So the number again is 837-7174. In New Iberia, if you're closer to our other office in New Iberia, they're hosting the exact same workshop. Their number is 367-2567. So right after the break, we're going to discuss 4 secrets to beating diabetes and obesity. So stay tuned. Welcome back to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President of the Bryant Wellness Institutes. We're Louisiana's most advanced functional medicine institutes, and today we're discussing our new initiative on diabetes and obesity. And we're talking about our free community workshop that I'm going to be hosting on June the 1st called 4 Secrets to Beating Diabetes and Obesity. And the main thing that I want you to understand from our first segment is there are things you can do to solve these obesity and diabetes problems. This is not a life sentence like we once thought it was. You know, you're not doomed to develop these terrible complications like amputations of the legs and blindness and kidney dialysis and kidney failures. You're not doomed to develop those things like we once thought. And as far as weight loss goes, the reason that our program is so effective is because we address the underlying reasons that your body is gaining weight in the first place. And really there are 6. There are 6 things that can cause your body to want to store fat. And we must address them one by one in order to get you down to your ideal size permanently. And if you don't address those things, weight loss becomes very, very difficult. But the thing about insulin and leptin balance and diabetes is that has to be looked at. And just keeping your blood sugar numbers in this box called normal, but then your insulin levels might be 5 or 6 times higher than normal, but that's not looked at, is not the best way to manage and treat these diabetes and prediabetes and weight problems, because insulin in very high levels is toxic in humans. I'll give you a perfect example of this. Alzheimer's, in 2005, the Journal of Alzheimer's, and listen, this is the Journal of Alzheimer's. These people wrote the book on Alzheimer's, and they began calling Alzheimer's diabetes of the brain because of the association with blood sugar, insulin, and brain health. Now, many people don't know this, but they are directly related to each other. Folks with diabetes, get this, folks with diabetes have twice the risk of developing Alzheimer's. But people with diabetes and that take medication that increases their insulin, like metformin, have a 4 times greater risk of getting Alzheimer's, because in high levels of insulin is toxic to humans. So we really have to rethink the way we're dealing with some of these, terrible diabetes and some of these other obesity and these diseases. So what is diabetes? Insulin is a hormone in your body that transports sugar inside your cells for energy. So in other words, your cells require fuel to run their processes, just like gasoline runs your car. Your cells require fuel to run their processes. Now, cells do things. A stomach cell produces acid, a skin cell protects, a nerve cell transmits. And so your cells they have a job, they have a purpose, and they require fuel to do that purpose, to run their processes. That fuel that your cells use is sugar, also known as glucose. So the glucose has to be put inside the cell so the cell can use it for energy, but the cell has a wall around it that's protective. That prevents the bad stuff from getting inside the cell, like viruses and bacteria. Your cell has a wall around it. Now, insulin's job is to transport the sugar or the glucose inside the cell to be used for energy. So it's as if insulin has a key that opens the cell wall and puts the glucose inside the cell for energy to be used. So insulin's job, real simply, is to unlock the cell wall and put the sugar inside the cell. Now, in type 2 diabetes, you have plenty of insulin. In fact, you have too much. But the cells have become resistant to it, meaning the key doesn't open the cell wall anymore. It's like the lock has been changed. So insulin can't open the door and put the sugar inside the cell to be used for energy. So the cells have become insulin resistant. So what happens is your body will begin to deposit extra fat cells to store that sugar in. So you have all this extra sugar sitting around. Your body has to do something with it. So it starts to deposit extra fat cells to store that sugar in. So you gain weight. Now that extra weight makes the insulin problem worse, And then you're stuck in this downward spiral of weight gain, insulin resistance, and fat storage. So at its core, when you boil this down to its finest idea, type 2 diabetes is a problem where the cells have become resistant to their insulin. So insulin no longer works. It's not a problem with blood sugar being too high. The reason your blood sugar is high is because the insulin can't open the lock and put the sugar inside the cell for use. Now, if we can figure that out, if we can discover why that's happening, now we're in the ball game of how we can get yourself better once and for all from some of these things. So when it comes to type 2 diabetes, it's all about finding out why someone's body has become resistant to their insulin versus just keeping your blood sugar in this box and calling it good and never even looking at insulin levels. That's not going to keep you healthy long term. So insulin can no longer pass the glucose into the cell for energy. So the body thinks it's starving. So then you get these sugar cravings all the time and you're constantly hungry. Now the blood glucose builds up and spills over into the kidneys and into the urine. So you begin to urinate more frequently, and we can pick that up on urinalysis, which we check for. This causes your body to be dehydrated, so you get excess thirst, and then the blood starts to get too thick, which we can pick up on our blood work, which we do. And this causes poor circulation, so the extremities, you start to get these non-healing wounds, and you start to get your extremities being cold frequently, like cold feet and cold hands. You start to get this diabetic neuropathy, which is the tingling in the extremities. We have a great treatment for that called cold laser, which is amazing. But then the tiny arteries of the eyes begin to be affected, eventually causing blindness. You get tired often because the cells don't have the glucose inside the cell to be used for energy. So this is a process. I mean, there's a lot that goes on here. And as this progresses, more and more insulin must be injected, and the cells get less and less glucose inside for use. And later on, the eyes are lost, leading to blindness. The limbs become so compromised that sometimes they need to be amputated, and the hunger and thirst continues, and cravings for more sugar gets worse and worse. And this process just continues to get more complicated over time. This is not a road that you're forced to walk down. It's pretty well known now that diabetes is not a life sentence. You can turn this around. And at the workshop, I'm going to give you real common sense solutions on how we can turn this thing around and get your body working correctly and get you down to your ideal weight once and for all. And it doesn't matter how far gone you think this is, there is still hope. But listen, obviously, just from what I've said so far, you can tell a lot goes into figuring this out. This is not something that you're going to figure all this out in a 3-minute office visit. You know, we've got to really sit down and try to figure out why your cells are not processing their insulin correctly like they should. And we have to figure out when this started. We have to look at nutritional factors. We have to look at family history. We have to test your insulin and your leptin levels. You know, leptin is a hormone that no one has ever heard of, yet it's probably the most important hormone in your body when it comes to managing diabetes and getting a patient to lose weight. I'm going to go into leptin after this break, but leptin and insulin balance is one of the keys. That's one of the 4 secrets. You know, it's called the 4 secrets to solving diabetes and obesity. And one of those 4 secrets is how we're able to balance your leptin and insulin levels. But if you have diabetes, even if you just want to learn how to lose weight, I'm going to encourage you to come to the workshop. And if you're concerned about kids or teenagers that are overweight, that's a real mission of mine, is helping young people with their weight problems. And we have 20 spots available. And if you want to call and register for the workshop, you can call right now at 837-7174 and leave your name and number on the machine. And when we get back to work Monday, we'll call and reserve your seat. Bring a friend or family member with you if you can. So it's 837-7174. That's 837-7174. In New Iberia, their number is 367 2567, or you can get all that on our Facebook page at the Bryant Wellness Institute. So right after this next break, I'm going to discuss the role of leptin and insulin, which leptin is the master hormone of weight and diabetes. And we'll discuss some dietary tips too, so don't go away. Welcome back to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President for the Bryant Wellness Institutes. We're Louisiana's most advanced functional medicine institutes, and we're discussing diabetes and obesity today. And the rates of diabetes has doubled in the last 20 years. So this is a big deal. So many people out there are suffering with it. And since Louisiana is actually the most overweight state in the country, and since the rates of diabetes and obesity in children and teens is higher than ever before in the history of mankind, this is a real problem that we need to address. You know, the average American now eats 180 pounds of sugar a year. And most children and teens, it's probably more than that. You know, so if your kids want a Pop-Tart for school in the morning and they want candy at every turn, and, you know, every time they go to the store, we need to start saying no. And, you know, Brandon, many times I'll be in Walmart or I'll be in the grocery store, and I see these kids that are in a stroller. They don't even have teeth yet, and they're sucking on a candy, either a sucker or gumming a Tootsie Roll and drinking a glass of juice. That's all pure sugar. Guys, this is destroying their young pancreas. The body's not even fully developed yet, and we're loading them up with sugar at every turn, and it's terrible for their little bodies to do this. And I see so many kids that are overweight when I go out to these schools and I do these workshops and programs that I do for youngsters. You know, I do programs for youngsters in school on attention problems and concentration problems and behavior problems, and I do workshops in schools and churches on some like ADDs and those type of things. And I see these kids that are, so many of them that are overweight and that are struggling with some of these behavior and attention problems. And guys, listen, if you have kids or grandkids that are overweight, please bring them in and let's sit down and talk about a program to try to solve this. We could change the whole course of the rest of their life. These kids know that they need help. They know they have weight problems. And, you know, the funny thing is when I go in and I sit down in a room with them and I ask them if they want me to try to help them solve this, they always do. Sometimes they just break out crying because someone finally has offered them some help of what they knew was a problem in the back of their head. They just didn't know what to do about it. And we do it without any judgment. And you know, I usually ask them first and let them bring it up. You know, a lot of times I'll ask them, Brandon, I'll say, you know, if there was something that you could change about your body, what would it be? Like if there was one thing you could change about your health or body, something maybe I could help you with, what would it be? And I let them bring it up. And then we're off and running. You know, it's real soft and it's real gentle. You know, we don't embarrass them or make them feel bad. We encourage the kids that come in to try to show them healthier choices in their life. And as parents, we always kind of see our kids as perfect, and we don't want to admit that they might need help with something, but I want you to take a really good look. You know, I'm here to help you for this and try to help you solve this. And I have a whole program for kids and teens with weight problems. And as I'm sure you can hear in my voice, this is something that's very, very dear to me. Don't let them develop diabetes. Don't let their weight hurt their self-esteem. You know, I have a tremendous program for children and teens specifically for their weight problems. And we're very positive and enthusiastic and encouraging. And we show them real world solutions on ways they can still eat like a kid, but be healthy and have a healthy weight all at the same time. And one of the secrets to my weight loss program for children and adults is how can we control a very important hormone called leptin. Leptin, many people have never even heard of leptin, yet it's the key to controlling weight and diabetes. You know, people have gone through, they've wasted so much money on all of these fad dietary programs, and you know, they've just thought they were okay just managing their blood sugar numbers with their diabetes. But if you can just control leptin is the key to controlling many of these things. So the thing about leptin is it's insulin's boss. So leptin basically tells insulin what to do. It controls the whole system. It controls fat metabolism. It controls blood sugar. It controls energy levels. So if you have diabetes or weight problems and you've never heard of leptin, that's really a shame because leptin is the key to restoring your health. It's one of the 4 secrets to you losing weight and managing your diabetes. And we're going to talk a lot more about that at the workshop where I have all my graphs and my charts and I can explain that a lot better. You know, charts and graphs don't work very good on the radio, but what I can tell you is this. If you're not doing something to balance all of these factors, you really don't have a chance of solving your diabetes or your weight problems long term. And you can do the fad diet. You can do, any of these, food where you order food programs off of TV and all that. But if you're not controlling leptin, they're not going to work long term. One of the reasons why my program is so effective long term is because it's based on actually educating the patient. And what I mean by this is, anybody can give you a list of do's and don'ts. You can get on the internet and get a diet program. But if I can sit down and educate you on the way your body actually processes food, now we're getting somewhere. Now you can actually educate yourself. So if you ever don't have your list or you're on vacation and you don't have your food with you, now you can know how your body is going to process these macronutrients. And macronutrients, by the way, are carbohydrates, fats, and proteins. And I'm going to give you a perfect example, and I'm sure you guys know someone out there who's a calorie counter and not paying attention to macronutrients. And I always use this as an example for the calorie counters. 1 piece of chocolate cake is 500 calories, and 3 chicken breasts are 500 calories. Now, if I'm on a calorie counting program, those 2 plates are identical. The cake and the chicken breasts are the same thing. They're both 500 calories. Now, my body is not going to process those 2 plates the same, right? We wish it would. We wish it would, right? It's not that easy. So my body is not going to process those 2 500 calories the same. So we have to look at macronutrients, and that's the key. And the cool thing is I have a really simple little app on my phone where I can keep track of macronutrients from day to day. But again, the key here is controlling diabetes and weight through the balance of leptin, insulin, and blood sugar. And how to obtain this balance is one of the 4 secrets that we're going to discuss on June the 1st at our 4 Secrets to Beating Diabetes and Obesity workshop. So you're listening to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President of the Bryant Wellness Institutes. We're Louisiana's most advanced functional medicine institutes. And if you'd like to register for our 4 Secrets to Beating Diabetes and Obesity workshop, it's going to be June the 1st at 7 p.m. at the Hilton Garden Inn. That's across from the Cajun Dome right here in Lafayette. You can call my office right now at 837-7174. That's 837-7174, and leave your name on the machine. And when we get back to work Monday, we'll call you personally to reserve your seat. You can bring friends with you. Just let us know how many seats you want, and we'll reserve your seats. You will leave there with the best understanding of what you can do to reverse this downward spiral of diabetes and obesity than anything that you've ever heard of. So that's 837-7174. In New Iberia, the number over there is 367-2567. Stay tuned. We'll be right back with more secrets to beating diabetes and obesity. Welcome back to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President of the Bryant Wellness Institutes, Louisiana's most advanced functional medicine institutes. And I hope you guys have learned today from the show that diabetes is not a life sentence. The rates of diabetes and prediabetes have doubled in the last 2 decades. And if that rate continues, the rates of blindness and leg amputations in the next 20 years will almost overwhelm our healthcare system. The rates of diabetes among young people has risen at a rate never before seen in the history of mankind. In fact, type 2 diabetes used to be called adult onset diabetes. Type 1 diabetes was called juvenile diabetes because type 1 was what kids got, type 2, or what you were born with. Type 2 diabetes was something that you got over time from, eating too much sugar and become insulin resistant. So many children are getting type 2 diabetes that they actually had to change the name from adult onset to type 2. Children in huge numbers are developing diabetes. But the truth is, we're not even looking at the right parameters we should be looking at whenever it comes to solving or dealing with diabetes. Everyone's so focused on keeping their blood sugar numbers in this little box, yet they don't realize that it's an insulin resistant problem. And we've got to look at insulin and leptin balance in managing diabetes and weight problems so that we can solve these things once and for all. And I say at the end of every break that we're Louisiana's most advanced functional medicine institutes. Now, you guys hear me say that all the time, but what is functional medicine? And I guess I should take some time to explain that to you. Basically, functional medicine means that we use advanced technologies such as frequency generators, microcurrents, lights, and detox units, and oxygen therapies, coupled with some of the most powerful supplements and nutraceuticals on the face of the earth to see if we can get your cells to start to work better, to do what they were designed to do. So think about this. Cells do things. A stomach cell produces acid, a muscle cell contracts, a nerve cell conducts, a skin cell protects, a colon cell absorbs, and so on. Cells make up tissues. Tissues are designed to perform functions. And when your cells start to malfunction, disease and sickness occurs. In functional medicine, we always ask ourselves, we want to know, why are your cells malfunctioning? What's preventing them from doing their job? And how to restore them? How do we get them to do what they're supposed to do? Now, that is an extremely complicated question and answer. Generally, what we find, though, is most disease processes have more than one cause. Most disease processes have a series of co-causes. So in functional medicine, basically, it's tracking down all of those co-causes at a cellular level, and we start to eliminate them one at a time. And if you can do that and you do it correctly, the body generally wants to restore function. There's just something standing in its way. Your cells are designed to process their insulin. It's just something's preventing them from doing that. And that is if we can do that, that's where you can regain your health and your cells can start to work normally again. And that is an amazing thing to do. When we can bring someone from disease and sickness to making their tissues start to function normally and healthy using no drugs or surgery whatsoever, that's a pretty remarkable thing. So in diabetes and obesity, we want to find out why your cells are not utilizing their insulin. Why is the lock? Remember, the insulin's job is to open the cell wall and put the sugar inside the cell to be used. In diabetes, the lock has changed. The insulin can no longer open the cell wall and put the sugar in. We have to find out why that has stopped working. It could be autoimmune. It could be the body's decided to attack and kill the normal healthy tissue along the way. It could be a problem with leptin production. We have to check that. It could be something with the cell wall itself, basically like the lock is jammed, like the door is jammed. No matter what you do, insulin can't get the sugar inside the cell. It could be there's some sort of a chemical toxin locking that cell wall together. And we have a list of about 6 chemical toxins that have proven to lock this cell wall where insulin can't open the door. We have to check all of that. It's possible that you've been exposed to some heavy metal like lead or mercury causing chaos in your system. It could be the timing of your macronutrients are off. So like I said, this is an extremely complicated question, but the only way for us to know what's going on is for us to sit down and figure all this out. If we can figure out what each of these co-causes are and eliminate them one at a time, your body wants to be healthy. Your cells want to be able to perform their normal function. And like I said, obviously you can't figure all that out in a 3-minute office visit. So if you want to come to the workshop and learn more about the body and how it deals with diabetes and obesity, and you'll leave there with the best understanding of what's going on in your body than you've ever had, then you can call and register right now. We only have 20 seats available for our program. It's going to fill up really quickly. Last time we ran out of space really fast. So the office number is 837-7174. That's 837-7174. And in New Iberia, the number is 367-2567. Or you can join us on Facebook at the Bryant Wellness Institutes. Once you get on Facebook, I have a a Thursday show I do there called Dr. Kevin Live and Online. I do that Thursdays at noon. And the neat thing about that is you can actually ask questions and it pops right up on your screen, and we can just have discussions in real time. And it's a fun little thing. So join us on Facebook at the Bryant Wellness Institutes. And I have a Thursday live and online show that I do there. So that number to register for the workshop, once again, was 837-7174. This has been Get Well Acadiana. I'm Dr. Kevin. Thank you for joining us.